inflammation or inflammatory disease of the nose. Rhinitis. Rhinitis is the inflammation and swelling of the mucous membrane of the nose, characterized by runny nose and stiffness, and usually caused by the common cold or seasonal allergy. Classification of rhinitis. There's acute or chronic types. The acute rhinitis commonly resulted from viral infections, but may also be a result of allergy, bacteria, or other causes. Chronic rhinitis usually occur with chronic sinusitis and the case called chronic rhinosinusitis. Also, there is allergic and non-allergic types of rhinitis. Allergic rhinitis is caused by reaction of the body's immune system to an environmental triggers. The most common environmental triggers include dust, molds, pollen, grasses, trees, animals. Symptom of allergic rhinitis, mostly patient complain from itching, sneezing, runny nose, stiffness of the nose, itchy and watery eyes, headache and swelling eyelids, cough, and treatment of allergic rhinitis. Most probably we control patient with the rhinitis through these principles by avoiding the substance that triggering the allergy, nasal, also by using of nasal corticosteroid spray, decrease nasal inflammatory reaction, nasal mucosal inflammatory reaction, using of antihistamines, systemic antihistamines, act to help to prevent allergic reaction. Also have benefit from nasal irrigation by using of normal saline or distilled water, help in clearance of the allergen and decrease the reaction of nasal mucus membrane. Using of antibiotic do not relieve the symptom of allergic rhinitis. A non-allergic rhinitis, this is another type of rhinitis caused by first acute viral rhinitis. The acute viral rhinitis can be caused by the variety of viruses, usually common cold type. The symptom consists of the runny nose, sneezing, congestion, postnasal drip, cough, and low-grade fever. The treatment of the non-allergic rhinitis اللي قلنا mostly viral type هو can use decongestant, local decongestant like nasal drop or nasal spray to decrease the stiffness of the nose. Also using of antihistamine, systemic antihistamine like Hyonil or other type of antihistamine help to control the runny nose. Here also using of antibiotic it's not effect in the treatment of acute viral rhinitis. In case of chronic rhinitis, it's usually extension of rhinitis caused by inflammation or viral infection. It also may rarely occur with some other disease like syphilis, tuberculosis, or rhinoscleroma, or rhinosporidiosis, or leishmaniasis, or histoplasmosis, or leprosy. The clinical feature of chronic rhinitis, mostly patient complain of nasal obstruction, and in severe cases crusting, frequent bleeding, thick foul smell post discharge from the nose. The treatment in general هو using of local decongestant may relieve the symptom, and treatment of underlying the other important type of the rhinitis or chronic rhinitis called atrophic rhinitis. Atrophic rhinitis form of chronic rhinitis in which the mucous membrane thin, atrophied and hard, were causing hard nasal crustacean, where have wide nasal patches. This atrophy often occur in older. Well, the presentation of the patient have crust form inside the nose and offensive odor develop with the breath of the patient. People may have recurrent severe nosebleed and can also lose their sense of the smell called anosmia. Treatment is aimed at reducing the crustation, يعني crusting, while eliminating the odor, and reducing the infection by frequent washing and using of other supplement to help the patient with the atrophic rhinitis. The other form of the rhinitis called vasomotor rhinitis, which is frequently seen after abusing of local decongestant, frequent abuse of local decongestant like nasal drop or nasal spray. Vasomotor rhinitis is form of chronic rhinitis. Nasal patient sense of nasal stiffness, sneezing and runny nose. Common allergic symptom occur when the allergens do not seem to be present and there is no clear allergen to regard that this case of allergic rhinitis. There is no allergy, only there is sign and symptom of allergic rhinitis. Treatment of vasomotor rhinitis is by the trial and error, and it's not always satisfactory. If the inflammation of the sinus is not severe, treatment aimed to relieving the symptom. There is important principle of management of rhinitis by nursing management, called nursing management of rhinitis, by patient education. Educate the patient that's how the pathophysiology of the rhinitis developed and what is the allergen, and by educate the patient that this is the real cause of the complaint of the patient, and this is the way to control his symptom. Instruct to avoid the exposure to allergens. Instruct about the using of medication like nasal spray or nasal drop. Teach about steam inhalation, it's very important. Teach about using of nasal instillation of the drugs. In case of the infective rhinitis, teach about the infection control measure including hand hygiene. Provide information about the influenza vaccine. Give special attention to violent population including immune compromised patients. Bacterial nasal infections called nasal vestibulitis. It's minor infections at the opening of the nose called nasal vestibulitis, may result in pimple at the base of nasal hair called folliculitis, and sometimes crust around the nostril. The cause is usually staphylococcus microorganism. The infection may result from nose picking or excessive nose blowing and causing a gnawing crust and bleed when the crust slough off. Bacteriacin ointment or other type of ointment usually used in control of nasal vestibulitis. In nasal furuncles, more serious infection resulting in boil furuncle in the nasal vestibule. Nasal furuncle may develop into spreading of the infection under the skin, causing cellulitis at the tip of the nose. وتريتمنت مالته antibiotic according to the causative organism. واحنا قلنا causative organism mostly هو الستاف using of augmentin or cephalosporin as يعني treatment of choice to control the staph infection. Also there is danger of ascending of this infection because the vestibule is the center of the danger area of the face. This is drained to the cavernous sinus and predisposed to intracranial infection. Other topics: nasal polyps. The polyp are common teardrop shape growth that form around the opening to the sinus cavities. A mature polyp simply is peeled seedless grape. This nice picture to see the nasal polyp, how it's glistening, how it's pale, where we can check this mass by the probing and found this mass is not bleed easily and it's not sensible. There is no sensation of this. The symptom of patient with the nasal polyp, usually patient present with the clinical picture of allergic rhinitis, rhinosinusitis, اللي هي sneezing, nasal congestion, obstruction, nasal obstruction, the drainage of fluid down through the throat, نسميه post nasal drip, facial pain, excessive discharge from the nose, loss of smell, نسميها anosmia أو hyposmia, itching around the eyes, chronic sinus infection. Still we are in the nasal polyp. How to treat patient with the nasal polyp? There is place of corticosteroid, either local, mostly used local corticosteroid in controlling of the early discover or small polyps. Sometimes need to use systemic steroid with this method. Sometimes need surgery. طبعا بالنسبة لل medical treatment also we can add using of systemic antihistamine with the local corticosteroid to control the allergic reaction in general. Sometimes needing surgery and most surgical procedure to excise the nasal polyp through the endoscope and follow the origin of these polyps inside the anterior and middle ethmoidal air cells. Other topics called sinusitis. Sinusitis is the inflammatory or inflammation of the sinuses, most commonly caused by the viral or bacterial infection or by an allergen, like the mucosa of the nose and nasal cavity. There is respiratory mucosa of the sinus, and there is sharing between the nose and nasal cavity and the sinus by the all the flow of all the pathophysiological procedure. It may acute sinusitis called or chronic long-standing sinusitis. The acute sinusitis is defined as acute if it's totally resolved less than 4 weeks. In people who have normally functioning immune system, acute sinusitis is usually caused by viral infection. Sometimes acute sinusitis is caused by bacteria. The chronic sinusitis is defined as chronic if it had been long, more than 12 weeks, 3 months. Causative factor including chronic allergen, nasal polyp, and exposure to environmental irritants such as airborne pollution and tobacco smoking. Positive family histories have strong predisposing factor. The subacute or recurrent type of sinusitis may be subacute lasting for between 4 to 12 weeks or recurrent of 4 or more episodes of acute sinusitis per year. Symptom of acute and chronic sinusitis have similar symptom اللي هي yellow to green pus discharge from the nose, pressure and pain inside the face, congestion and blockage in the nose, tenderness and swelling over the affected sinus, reduced ability to smell اللي هي hyposmia, و bad breath اللي هو يسمى halitosis, or productive cough especially at night, which is pathognomonic for the sinusitis. There is site-specific symptom. There is يعني special symptom related to the each sinus. We can direct our question toward these areas or these sign and symptom to clarify the affected sinus. Maxillary sinusitis cause pain over the cheek, just below the eyes, toothache, and headache. The frontal sinusitis cause headache over the forehead, and this type of headache usually awake patient at midnight. Ethmoid sinusitis cause pain behind the and between the eyes, tearing and headache, often described as splitting headache over the forehead. Sphenoidal sinusitis cause pain that does not occur in well-defined area. There is no localized pain, headache in general, and may be felt in the front or back of the head. Regarding complication of sinusitis, complication of the sinusitis mostly occur due to spread of the bacterial infection to the adjacent tissue, change in the vision or swelling around the eyes, or eye pain, meningitis, and cause severe headache and confusion. How to diagnose patient with the sinusitis? You can taking short history with previous leading, trained with the previous leading question related to the sign and symptom of dysfunction of the nose and paranasal sinuses. Also, examination of the area of the sinus and the neighbor area, include examination of the nose, nasal cavity, oral cavity, and postnasal space. And also radiological examination, investigation اللي هي plain paranasal sinus X-ray or CT scan, computerized tomography with the different section. Also might need sinus fluid culture by nasal endoscope to differentiate those with the infection or have malignant cell or have blood in the sinus fluid. Treatment of sinusitis is aimed at improving the sinus drainage and curing the infection. Mostly use steam inhalation, hot wet towel over the affected sinus, and the hot may help to relieve the swelling membrane and promote the drainage. Nasal irrigation or using of saline nasal spray also can help the symptom. Using of antibiotic, mostly in case of the acute sinusitis, that's between 3 or more days of symptom such as fever and severe pain, or persist for 10 days or more. Using of antibiotic like amoxicillin, glevenate or doxycycline. People who have chronic sinusitis taking the same antibiotic but for longer period, for 4 to 6 weeks. بالacute sinusitis the treatment for 10 days. بالchronic sinusitis الرينج مالتها 4 to 6 weeks. Surgery, the place of surgery in the sinusitis is depend on our history, clinical examination and investigation, and if we found that there is surgical predisposing factor leading to initiation of the sinusitis. Also, when antibiotics are not effective, surgery may be performed either to wash out the sinus and obtain material for culture or improving sinus drainage, which allow the inflammation to resolve. Even in nasal obstruction that interfere with the drainage may also require surgery. Nasal obstruction either due to nasal septal deviation or nasal polyp or nasal mass or nasal synechia, adhesions between two walls of the nasal cavity leading to obstruction of the sinus ostia that need surgical interference. What is the sinus surgery? Sinus surgery is a procedure that aims to open the pathway of the sinuses and clear the blockage. This is option for people with the ignoring and recurrent sinus infection, for people with the abnormal sinus structure or abnormal growth inside the sinus. There is advance in the sinus surgery called functional endoscopic sinus surgery, FIS. FIS is carried out with the tool called an endoscope. This is an illuminated thin fiber optic tube. The endoscope is inserted into the nose to reach the opening of the sinus. Micro telescope and surgical instrument can then be passed down to the endoscope and using to carry out the procedure. The surgeon will use this tool to remove the obstructive tissue and other blockage to clear the sinus. FIS, still we are in FIS. The entire procedure is carried out through the nostril and leaving little to no scarring. Some swelling may occur, but it will disappear quite quickly. A person who has this surgery will usually only feel mild discomfort for the short period after time. This is the most of the advantage of the endoscopic functional endoscopic sinus surgery. FIS can be performed frequently. It can also be carried out on an outpatient basis. There is important topic, especially in our period, our difficult health situation acted by corona, by frequently affecting people by coronavirus. This is fungal sinus infection. Fungal boil are overgrowth of aspergillus fungi in healthy people. Symptoms include sinus pain, pressure, nasal congestion, and drainage of fluid. Surgery is needed to open the affected sinus and removing the fungal debris. This is our interesting type of the fungal infection called invasive fungal sinusitis. It's very serious disorder that develop most often in people whose immune system is impaired by chemotherapy or by uncontrolled diabetic, leukemia, lymphoma, multiple myeloma, or AIDS. It may spread rapidly to neighbor area and destruct all the bones and other area. Symptoms include pain, fever, and discharge of pus from the nose. Treatment is surgery and using of antifungal drug. A new topic very frequently seen called allergic fungal sinusitis is chronic sinusitis, in which the fungal cause an allergic reaction characterized by the marked nasal congestion and formation of nasal and sinus polyps. Surgery typically required to open up the sinus and to remove the fungal debris. Long-term treatment is also required with corticosteroid and antifungal drug. New topic, sinonasal inflammatory polyp, which is the ordinary bilateral nasal polyposis frequently seen in those patients with the allergic rhinitis. Its inflammatory nasal polyp are inflammatory polypoidal sinonasal mucous tissue that arising in response to inflammatory stimuli such as allergen, infection, or other systemic process such as using of aspirin in those patients with the aspirin intolerance or those patients with the cystic fibrosis. The mainstay in the medical treatment of the sinonasal polyp is nasal corticosteroid, as we called before, that the local corticosteroid is the main or cornerstone of treatment of the nasal polyposis.